They've actually been recognized. I think they're in Atlanta, Georgia, either this week or next, making a presentation on this coordinated effort that's moving forward. On the area of clinical or translational research, we've worked very hard, and this would not have been successful without our partners with Boston Consulting Group, and then ultimately through our introduction to them through Jim Tyree, bringing in a world-renowned contract research organization to work with the academic medical institutions. That was one of the themes that was talked about. We heard it loudly and clearly. Bringing in a CRO to the district not only adds credibility to the district, it will better enhance the academic institution's ability to manage clinical trials. We firmly believe it will result in the addition of many more clinical trials coming into the Illinois Medical District, as well as funding from entities such as the National Institute of Health. We also know that these are declining research days for large pharma organizations, a lot of consolidation going on within that industry, and that there needs to be, or there is the opportunity for much greater collaboration with private pharma and our research institutions here in the medical district. I work closely with a number of those pharmaceutical companies in my prior positions. We are working with them, building those bridges to lead to enhanced R&D opportunities. In the area of clinical data, this is frankly an area that we thought would take a while to really coalesce around some of the initiatives, but again, we are finding that we're making much quicker progress than we originally anticipated. The foundation, however, builds around the type of infrastructure that we have. It's an overlap with the infrastructure theme, but we have to make sure that we have high-speed fiber networks available to all entities throughout the district. We need to be able to connect those fiber optic networks. We have close partnerships with the state, with the University of Illinois, with the County of Cook and the City of Chicago to build out that type of infrastructure, and the possibilities that brings are endless. We are working closely, and thank the University of Illinois and President Woodard for her leadership in bringing to the table a partnership with the National Center for Super Colliding Applications, supercomputing applications at the University of Illinois. The Blue Water supercomputing systems that are just now going online. They are very interested in working with our district partners on supercomputing projects that will have the ability to analyze huge quantities of medical data to improve health outcomes in a number of different areas. We're taking a team down to Urbana early next month to meet with the leadership to actually start to plan specific projects of data analysis that we can bring in to the district. So yeah, I think that just gives you a flavor of a few of the initiatives under each of the four themes. But again, consistent with the vision, the bottom line is also to be a driver for the economic growth. We believe that these initiatives just in and of themselves, and they are fluid, and they change, and they evolve, and there are new ones that come online potentially for consideration anyway, at least if not weekly, almost daily. But we firmly know that just based on the analysis we've done of these initiatives, that we can create a lot of new jobs, both interim jobs, but as importantly, probably more importantly, long-term, high-paying medical professional jobs, as well as provide a pipeline for frontline positions in the hospitals that is so critical for the recovery of the regional, state, city economy. That will be a driver that goes into the decision making on every project that we pursue going forward. It is truly an exciting day. We could not be here today without the support of nearly every one of you in this room. We've talked some about the partnerships that we've done to develop. And at this point, we're going to hear from some of those partners to learn about their perspective on our new strategic direction. And with that, initially would like to recognize and call upon Dr. Wendy Brown, the Chief of Staff for the Jesse Brown Veterans Administration Medical Center, to talk about her role and the role of the Veterans Administration Hospital in working with the medical district.
Thank you, Mr. Rivlin. Jesse Brown VA Medical Center is absolutely delighted to be a part of the newly reinvigorated Illinois Medical District. Even though we're proximate to each other, the collaboration has not always been what it should. And now that we have an opportunity to meet and mix on various initiatives, it is possible for us to collaborate in a way that's very synergistic. Just a few minutes ago, Mr. Morales and I had a conversation about a couple of initiatives that we think Stroger and Jesse Brown VA could collaborate on to better serve the individuals that we take care of. That's just one example. In addition, as some of you know and some of you probably don't, Jesse Brown is landlocked. So the fact that we were able to lease space up on the second floor, which is quite beautiful, by the way, is wonderful for us because it allows us to decompress our main buildings so that we can move some of the administrative services here and provide better clinical care for our increasing population of veterans. We also look forward to some of the clinical trials initiatives, to providing those opportunities for our veterans, which are not always that easy to come by. And lastly, I would like to comment on the Ogden space, because if we could just put up a few buildings that would act as a windbreak, I wouldn't blow across the field every time I come here. So we're supportive of every aspect of what the Illinois Medical District strategic plan is putting forward. Thank you very much.
Thank you. I'd like to call upon John Morales, Chief Financial Officer for the John H. Stroger Jr. Hospital of Cook County, another valued partner. John.
Thank you, Mr. Rivlin. Madam President, members of the board, it's a pleasure to be here this afternoon to address you. I just wanted to take a few moments. First of all, Dr. Ram Raju, our Chief Executive, wasn't able to attend this afternoon and send his regrets. However, this is a very important moment because the Illinois Medical District, I have both, representing the Cook County Health and Hospital System as well as myself personally. I have some very good experiences that I want to share very briefly with you that have really meant a lot, not only to our overall transformation, but also to our ongoing development. The one thing that I have really found to be very significant is that the Illinois Medical District is extremely community health focused. It's not just one or the other, it's community based. And our demographic that we serve is an important one, our mission is an important one, and because of the participation and the support that we've received from the Illinois Medical District Commission. I can digress